The following portion of Good Day PA is sponsored by Penn State Health. Next month, we will celebrate Asian American and Pacific Islander Heritage Month. Health equity is important as it relates to our cultures and ensuring everyone has access to the quality health care they need. Here to tell us more about how we can inspire others to help in that mission is Dr. Alice Zhang. Explain the meaning of health equity to our viewers and tell us what inspired you to raise awareness of its importance.
Yeah, so to me, health equity means making sure everyone has an equal opportunity to be healthy. What some people may not realize is that we do need to account for where people are coming from, their circumstances, and maybe make some adjustments or accommodations so they have the opportunity. And this was something that I was introduced to from a young age. I didn't quite know the concept or terminology, but my mom had some health issues growing up, and as a first generation, many second generation children, they help their parents through the healthcare system. And so I was helping my mom navigate through the system. And I could see how sometimes the system treats people who may not speak English well, how sometimes there's gaps in understanding that need to be bridged, and how important it is to have a provider who you can trust when making important decisions. So that partly motivated me to become a doctor as well.
Wow, that's incredible. So that's your personal experience. And then, as you said, you became a doctor, you're a staff physician in family and community medicine. And how's that influenced your approach to this, especially when it does come to diverse populations like Asian Americans?
Mm-hmm. So as a family medicine doc at Penn State, I am privileged to take care of a fairly diverse population, and I take that privilege pretty seriously. And I am a little bit hyper aware that for some of my patients, including my Asian American patients, I may be one of the few people who understand what they're going through and can kind of relate to them a little bit more. So I try to be an advocate for them. I try to put in a little bit extra effort to make sure that they're not falling through the gaps and try to make sure to get the care that they need.
What do you think really are the challenges that they're facing?
So from my personal experience, I can tell, with my mom, how it can be hard navigating a primarily English-based system if English is not your first language or you don't speak it that well. And I know as a provider too, trying to take the medical knowledge and advice that we have and make it adaptable for our patients can be a little bit hard. So for example, we know that a Mediterranean diet is healthy and good for the heart. But how can we translate that and make it relatable to our patients who might not, for example, eat olives or olive oil on a daily basis?
Sure.
So I think that we're missing some of that in some of our education, and making that advice relatable for patients can be difficult.
That makes a lot of sense, actually, just that simple explanation about like olives and olive oil. Looking ahead, how do you think, we as a whole society and physicians and everybody really achieve better inclusivity?
Yeah, and I think it's hard, but I think when we make decisions and plan for things, we need to look to see who's at the table, but more importantly, who isn't at the table, and try to make sure we include their voices, their perspectives, because they have a lot of experiences and can tell us maybe about these nuances in care that we're missing, and be able to provide them some better care for them.
I can tell you enjoy this. You enjoy advocating. Like your heart is in it. So that's just terrific. Thank you for being with us today.
Thank you for having me.
Good to have you. The previous portion of Good Day PA was sponsored by Penn State Health. We'll be right back.